Hey everyone, I'm John Lynn, the founder and chief editor at Healthcare IT Today. We're excited to bring you another in our series of interviews with top leaders in health IT. And our guest today is Patrick Shees. He's president and CISO at Darena Solutions. Welcome, Patrick.
Hello, John. Good to see you.
Yeah, good to have you back. And this is going to be fun. We're going to do a little bit of interview, a little bit of demo of the MeldRx platform. And, you got some prize money. So we're going to talk about that too. But before we get to that, tell us a little bit about yourself and MeldRx.
Okay, cool. So I work for a company called Darena Solutions, been around 15 years or so, primarily in the regulatory space. Most people know us for some of our products that have been wildly successful over the past few years. But with regulatory, we've amassed so much knowledge and expertise and learnings over the past few years that we've decided to crank out this awesome new product called MeldRx. And MeldRx is basically a fully managed FHIR backend as a service that allows organizations of any size to build or buy solutions that can work alongside their existing clinical workflows. We want to help our customers get more out of their EHRs. So we're not trying to replace an EHR, but we want to work alongside it, enabling things like apps. I think apps are a really hot topic right now, especially in the AI space. Like how you've got all this great data. What can you do to like really level up the experience for a clinician and give them access to more insights and more options at point of care? And also for research and pairs and some of these other types of scenarios. But we can definitely get into those in a little bit.
Yeah, absolutely. And I think it's interesting for me because probably the number one question I get from health IT companies is how should I integrate with the EHR? They're like, I hear about FHIR. How do I do this? Right. And MeldRx is an easy way for them to get data from the EHR using FHIR to write back to the EHR or even write to themselves. So I think it's really interesting that what you offer. But I think what's even more fascinating for this video is you recently announced a competition with some great prizes, cash, that's always the best prize. But tell us about the competition, talk about some of the prizes that you're going to include, for those that want to be involved with it.
Right. So this competition was really born as a part of B11. So that's the United States healthcare regulation that is effectively trying to introduce AI workflows into the EHR market. So as we are rolling this out to customers and we're getting a lot more people asking questions, what we're noticing is that there's a lot of confusion around the requirements for building predictive and evidence-based apps in EHRs. So we built this app competition to align with those requirements to really get the ball rolling and not only like get some pretty cool apps out of it, but also to help people start to really understand how to do this. So it's one thing when regulation gets slammed down, it's like, okay, like do all this, thou shalt, whatever. But sometimes the what's left in the wake to try to get people up to speed and running and this become a little bit more natural, a part of their workflow is a little bit more challenging. So we feel really strongly that AI in healthcare is really less about the technology itself and more about being able to build trust. And we think that the regulation is going to drive a large part of that adoption story.
That's
So
awesome.
yeah, prizes. You asked about prizes. Let's not forget about the cash prizes. Right
Yeah, definitely.
now, yeah, right now our prize pool is $25,000 cash. The top prize is $10,000 to the grand prize winner. But we also have some really cool sponsors, including a certain healthcare IT today that
Yeah.
we're very excited. Maybe you want to give a short overview over what healthcare IT today is offering.
Yeah, absolutely. I mean, I think, we heard about the app competition. We love highlighting innovative solutions in healthcare. So it made a lot of sense for us to offer one of our 3-in-1 interview packages to the winner. We'll be doing that. So the grand prize winner will feature them on a video and an article and a podcast on Healthcare IT Today going out to our 200,000 users. So that's a nice prize. We also, I know there's a sub competition that's going to happen at Vive as well, where we're going to do a short video that will go out on our social channels, which does phenomenally well, gets thousands of people, watching and learning about your app. So, there's a number of those in-kind prizes, if you will, that you'll get as part of winning, along with, of course, the cash. Who doesn't like that?
Who doesn't love cash? So many
Yeah.
ways to spend it.
Yeah. So what does it take to participate in the competition? What do the apps need to do to be able to participate? And, is it a heavy lift or, the long integration or, what all needs to be done to be able to take part in the competition and get access to the opportunity to win that cash prize?
Good question. First and foremost, this is a predictive AI app competition, so not generative. So it needs to leverage an AI model to make predictions around some sort of healthcare related problem. We've had a lot of questions about does it have to be specific, like in a clinical scenario? The answer is essentially no, it doesn't have to be clinical, but it does need to solve a healthcare related problem. So it could be something like operational efficiency in a hospital, doesn't necessarily have to be like disease risk prevention score tracking or that kind of thing. We have a hackathon website, which is meldrx-predictive-ai.devpost.com. So we're using the DevPost platform. And in order to enter the competition, you need to register on DevPost. We have all of our project rules and submission guidelines there, and your app must be registered on MeldRx. So to actually work in MeldRx, your app has to support Smart on FHIR. So that's either with CDS hooks, clinical decision support hooks, or EHR launch. And CDS hooks are essentially alert-driven workflows. So that would be a provider, clinician opens a chart, patient chart. The chart gets sent to some sort of a service, which generates an alert. And then the alerts are displayed to the provider, and they can make some sort of a decision based on what's shown back to them. So there's a standard format known as a CDS card that these are supposed to be presented in. And that's one way to enter the app competition. The other is EHR launch. And that is literally you can click a button inside of the patient chart and launch a full app that maintains the patient context. So the patient can be used in a completely different app without needing to go through any extra hoops.
Awesome.
Yeah.
Let's see an example use case, maybe a demo of the MeldRx platform so they know what they could do as they integrate their AI solution into MeldRx.
Right. I am logged in to MeldRx right now as a brand new, fresh account that was just created. First thing I'm going to do is I'm going to create a workspace, which is effectively a FHIR API. So I'm going to call it Healthcare IT Today Workspace. Hit create workspace, and literally in seconds, I have a fully functioning FHIR API, which is out there, and I can see all of the great things that it can do. Next thing I'm going to do is I'm going to register an app. So this would be the app that I've created. I'm going to register it so that it works with MeldRx. I'm going to give it a name, which I'm going to call Healthcare IT Today Readmission Risk. We're going to use service URL, and I'm just going to put in a CDS service that I know is out there and works. I'm going to click on continue to publish. Here I can put in all of the information about my app so that when people go to use this, they know what it is that they're actually interacting with. If I'm building this app for a B11 certified solution, I can select evidence-based or predictive DSI, decision support information. All of the source attributes that have been defined by the US government are here. I can fill those in if I want. But for now, I'm going to just return to my workspace. Okay, so I have my workspace, which is my FHIR server. And what I need to do is I need to enable that CDS app that we just registered in my workspace. So I'm going to go to extensions, which are effectively ways to add apps to your workspace. I'm going to add an extension, activate, look at my organization, and then this Healthcare IT Today Readmission Risk CDS Hooks app. I'm going to select it. I'm going to activate it. And now it's there for any of my clinicians, providers, etc., to use when they are viewing patient charts. So let's look at a patient. First thing I'm going to do, since this is a brand new FHIR API that we just created, I'm going to import data, starting with one of my all-time favorites, the GOAT, Alice Newman. I'm uploading Alice Newman's patient chart. When I refresh, here's Alice Newman. Let's click into it and see what we can look at. So first and foremost, this is a patient chart similar to what you would see in an EHR. I can see any documents that have been added. I can see all of the patient data that's been converted from the CCDA format to FHIR. So for example, if I click on patient and view FHIR data, I can see all of the great things about Alice Newman and her life, which is fantastic. But one of the things that's really interesting and why we're even talking about this right now is the CDS alerts that have been generated. So remember, we added an app that has the ability to predict readmission based on a variety of different things that go into a predictive AI model. So this pops up with a warning letting me as a clinician know that Alice Newman, based on her health history, has a 75% chance of bounce back, which is probably fairly significant. That's why it's a warning, not a critical and not an information. So this is something that we might need to do something about. So as a provider, I can click on view analysis and it will actually launch a completely different app. This is the app that we registered, and I can see here that it says Alice Newman. It has all of the information about her patient chart. And this is really useful. This is really great because I didn't have to sign in. I didn't have to do anything. It carried along with it this completely different application, the Alice Newman patient context, which I think is where inside of a clinical workflow will be very, very strong. So to recap, if I created a brand new FHIR API, which is sitting out there available on the internet, I registered a CDS Hooks app. If I were doing the app competition, I would need to publish the app and fill out all of the source attributes for predictive DSI. In my workspace, I enabled the extension for the app that we registered. And then when I viewed the patient, I was able to see the CDS alerts or launch the EHR launch application. And once you've done all that, if you go to the Predictive AI in Healthcare with FHIR hackathon website and join the hackathon, you will be able to create your submission and potentially win some of the various lucrative cash prizes or some of our sponsored prizes, which we talked about in this video.
Wow, that's really interesting to see how they can integrate their data using important standards like FHIR to enable their application and their predictive analytics solution. So talk to me, does this work with all EHRs or is it with just a few? Because it's great that they're participating in the competition, but if I'm a developer, I want to use it after the competition as well. So talk to us, does it work with all EHRs or just some of them?
Ideally, yes. So the competition is focused around building apps using the standards that should be present in all US-based EHRs. So that's G10, HTI1, Smart on Fire, etc. So again, that's US regulatory. That said, a lot of these EHRs are being used outside of the US. So if someone is using a US certified EHR that leverages FHIR and Smart on Fire, yes.
Yeah.
I don't know a better
Which
way
in
to
the
answer that
US
one.
is pretty much every EHR. So that's the good news is that every EHR in the US is pretty much certified. There's maybe a few home care ones and whatnot that haven't, but every major acute and ambulatory is. So that's awesome. I guess that's the beauty of standards and certification. It can work across them. Do you have some examples of apps or companies that could be a fit for taking part in the competition and kind of benefiting from the MeldRx platform in these FHIR integrations?
So the biggest use cases that we've seen are mostly around disease and risk prevention. So I think one of the biggest ones that is like super high right now is sepsis risk prediction, right?
Of
And also
course.
we've seen like readmission and bounce backs, like how likely is this person as they walk out of our institution to be back in 30 days or whatever. Another really big one is clinical trial recruitment. We've
Mm,
been seeing that like really popping off, looking for ways to determine if someone is a good fit for a clinical trial, which honestly is like a win-win, both usually for the person getting recruited and for the institution that's running the clinical trial. But yeah, we recently became a CHI member, and we're trying to play an active role in these discussions with them. And I think that what we're seeing is that it's going to be really important to everybody that we, push AI forward responsibly and have good guardrails for establishing trust and making all of these types of use cases and companies successful. So while I think right now, yes, it is mostly for us about certain use cases that we're enabling, I think that as we start to progress and, a few months and years down the road, I would say it's probably going to be almost every healthcare related company that these could potentially apply to.
Interesting. Yeah, I mean,
Yeah.
it makes sense. The disease ones, sepsis, clinical trials, hot topics, reducing hospital readmissions is a hot one. But I love that you also accept the operational ones. I imagine there's some interesting revenue cycle, predictive AI out there, or even, appointment scheduling, cancellations, reminders, wellness visits, chronic care management. So
Yep.
there's such a plethora of companies out there that AI can apply to and need access to that EHR data. So super interesting. Where can people go to learn more about the competition, to see the details, be able to, obviously dive in more into what's required and, learn more about the prizes and then obviously submit the applications?
The best place to go to check out the competition is going to be the actual DevPost hackathon site. So that's meldrx-predictive-ai.devpost.com. And we have all of the submission details, guidelines. We have a really cool video featuring yours truly, where we talk about, what it is we're trying to accomplish. You can see all the prizes. We have some celebrity judges that we're really excited about getting to partner with. And I think that's probably the best place to go.
Love it. Well, I love that people are going to be able to do something that they need, which is get access to the EHR data for their application. They're going to get exposure to the community. They're going to exposure on Healthcare IT Today and win some cash prizes. Sounds like a great competition. Patrick,
Totally.
I appreciate you taking time to talk with us and share about this great competition and what MeldRx can do to help these app developers improve their solution. And thanks everyone for watching and listening. If you want to find more great healthcare IT content like this, be sure to check it out at healthcareittoday.com or search for Healthcare IT Today on your favorite podcasting applications. Thanks, Patrick.
Appreciate it, John. Thank you.